Okay, here we go. I promised you a little information about CBD oil, and here it is. Now, I'm sorry it took so long, but as my son Jude says, reasons. Now, I'm going to try to keep this short and sweet, but I want to hit all the high points of information that I think is important for you to know and the question people ask me. If necessary, I can put together a full-blown lecture or webinar at another time. So, as I said, people have been asking me about CBD lately. You see it advertised all over the place, smoke shops, gas stations, even ShopRite. You hear all these miraculous things about it, but probably 95% of the people out there, even those selling it, have no idea what it is. Now, in the 1990s, a biological system in the body was discovered, and it was named after the plant that led to its discovery, the endocannabinoid system. Some researchers feel it's one of the most important physiological systems involved in establishing and maintaining human health. You see, these endocannabinoid receptors are found all over your body, in your brain, your spinal cord, your nerves, your immune cells, and virtually all organs of the body. Now, where does CBD come from? It comes from the plant known as cannabis. For our purposes right now, there's two forms of cannabis we need to talk about: marijuana and hemp. Both marijuana and hemp contain CBD. However, hemp does not have any appreciable amount of THC, while marijuana does. THC is the component of the cannabis plant that has the psychoactive qualities. It's the chemical that gets you high. CBD does not get you high. Now, THC does have some medicinal properties besides getting you high, but until marijuana is legal in this state, don't even worry about it. Because hemp has extremely low levels of THC, most CBD oil you find actually comes from hemp. That's why you see it advertised so much lately. The Federal Farm Bill of 2018 legalized the regulated production of hemp, which until that point has not been differentiated from other forms of cannabis, specifically the kind that can get you high, and was essentially illegal to produce. Yeah. I know there were some loopholes previously that allowed people to produce hemp in certain smaller quantities, but that's not what we're discussing. So, okay, let's get into what CBD is good for. One of the biggest benefits of CBD is supposed to have that is that it can be good for pain. Guess what? It is, or at least it can be. Every part of the nervous system can contain CB receptors. The nerve endings where the pain is created have CB receptors. The spinal cord where pain is transmitted has CBD receptors. And the brain where nerve signals get interpreted as pain have CB receptors. So the research shows that CBD can be good for pain, especially since it works at all three levels of the nervous system that are involved in pain. CBD can also help reduce inflammation, which is important in managing pain as well. Now, Jessica had asked about CBD and migraines. There's not a lot of research out there about CBD and migraines. That's the problem. Until the Farm Bill legalized hemp, and since the federal government considers cannabis a Schedule 1 dangerous drug, it has been difficult to do research on it, even though it's a part of the cannabis plant that does not get you high. However, there's anecdotal evidence, and since we know that the brain has CB1 receptors and CBD can also help reduce inflammation, it makes sense that it could help with migraines. CBD has pain relieving properties, it can help lessen nausea and vomiting, and has powerful anti inflammatory properties. All three of these things are hallmarks of migraines. Now, people often ask about CBD and anxiety and depression. Again, research is limited, but studies have shown that it has antidepressive and antipsychotic properties. It can also help with addiction and withdrawal. One study showed a 14% decrease in episodes of people suffering from PTSD after 8 weeks. Now, for people with autoimmune or immune related diseases like MS, celiac disease, Crohn's disease, rheumatoid arthritis, lupus, etc., CBD can be helpful as well. Now, since I doubt you're a biochemistry geek like me, I won't get into how it inhibits pro inflammatory cytokines or how it boosts interleukins 4 and 10. But just know that it can modulate the immune attack of your own body. Now, believe it or not, CBD also appears to be good for bone health. It seems to inhibit what we call osteoclasts, which are cells that break down bone. Now, when it comes to the brain, CBD has shown promise in helping motor disorders like Parkinson's and other tremor disorders. It can help seizure disorders like epilepsy, memory disorders, sleep disorders, even traumatic brain injury. It may even help with brain tumors and other cancers, but that's way beyond my scope of practice, and I'm not going to go there tonight. Okay, now we know what CBD might be good for. The next question is it legal? Well, how could it not be legal? They sell it everywhere. Well, that's where things get a little tricky. Some legal experts say there are conflicts between the Farm Bill and the use of hemp as a type of medicine. This country's laws regarding anything cannabis related are still screwed up. The biggest potential conflict I know of is that if you use a CBD isolate. That means you extract CBD and CBD only from the hemp and use that only. Why could that be a problem? CBD is used in a prescription drug to treat epilepsy. So if you use a CBD isolate, in theory, the minds of the FDA, you may be using a prescription drug without a prescription and for off-label purposes. However, some experts say that if you're using a full spectrum hemp extract with all of the parts of the hemp plant, not just CBD, you're fine. This is the United States of America. What can I tell you? Anyway, you're better off using a full spectrum hemp product anyway. Even though CBD is considered the active part of the plant, there are also other cannabinoids in hemp that have benefits as well. CBN, CBG, CBC, CBT, and other terpenes, flavonoids, vitamins, minerals that can be helpful as well. Some theorize that they work together with CBD to make it more effective in the body. That's why I think a full spectrum hemp oil is better. So besides being full spectrum, what else should you look at for in a CBD oil? It should be organic, plain and simple. Why take more toxins into your body? It should be extracted by either alcohol or CO2. Once again, other solvents can be toxic, so why bother? CO2 extraction is probably the healthiest method. Now, people ask me, how much should I take? That's a question that really has no answer for a few different reasons. Number one, concentrations aren't standardized to this point. You don't really know how much CBD is in brand A versus brand B versus brand C. That's like asking, how much vitamin C should I take, 1 capsule or 2? I don't know. Is there 25 milligrams in each capsule or 250 milligrams in each capsule? Number two, everybody responds differently. With the brand that I'm using, most people respond best to 0.5 milliliter twice a day. Some people need up to 3 milliliters twice a day. Surprisingly, many people do better on 0.5 milliliter twice a day than they do at higher doses. Everybody's different. Another factor that affects the dose is how absorbable it is. Your body doesn't absorb oils very well, and often they're broken down by the liver before they get into your system. In my experience, all fat-soluble compounds and many water-soluble ones are better absorbed and distributed to the body if taken in a liposomal form. Again, not to get too biochemistry-ish on you, but liposomal means it's encased in lipids and can be more readily absorbed directly into your cells. So take my word for it. Unless you want to go back and do your cell physiology notes from college, in this case, liposomal is better. Now, the brand that I'm currently using is water-soluble due to its liposomal delivery system and has about a 90% absorption rate, which is confirmed by an independent lab. I haven't found any other company with an absorption rate like that, or even a company that's had its absorption verified by an independent lab. As a matter of fact, a colleague of mine who's a real research geek, sorry, Jared, asked 40 companies for absorption studies, and only 2 of them produced them. Only one of those studies was done by an independent lab. Now, the final factor in how much comes down to how long does it last in your body. So your body, specifically your liver, will break down the CBD you take in and excrete it. In the brand that I'm experimenting with, studies show that it lasts in the system for about 12 hours. Now, one of the other common questions I get is, does it have side effects? Can I take it with other drugs? Some of the possible side effects are dry mouth, changes in appetite, changes in mood, drowsiness, and other things. Can you take it with other drugs? That's tricky. It doesn't really have many interactions with other drugs, but it's cleared by the detox system in the liver, specifically the system called cytochrome P450 that detoxes other medications as well. So if your liver is detoxing CBD, it might be slowing the detoxification of some specific medications at the same time. This can cause a dose of these drugs, like, for example, Coumadin, to build up to a higher dose in your body because they're not excreted as fast. Still researching this issue to see best how to handle it. I have had some colleagues who've had success by separating the doses. If the patient takes a medication in the morning, they take the CBD at night. One safe rule is the grapefruit rule, or grapefruit juice rule. If your pharmacist tells you not to drink grapefruit juice with your medication, you'd probably be better off avoiding CBD as well. On the other hand, most CBD doses are probably low enough that they won't cause much of a problem. Unfortunately, again, because of the government's classification of cannabis as a Schedule I drug, not enough research has been done yet. So as always, you should consult with your physician or even your pharmacist if you have any concerns. Will CBD cause you to fail a drug test? By definition, hemp needs to contain less than 0.3% THC. Many hemp products contain less. The brand that I'm testing right now usually has concentrations that are lower than that. And they even have a QR code on each bottle that gives you analysis of the specific batch that bottle came from and its THC content. So will you fail a drug test if you take CBD? It's hard to tell. You shouldn't if your product has low THC levels, but if you get your product at a gas station or a head shop, who knows? This is what I do know. I have a colleague that does physical exams for commercial driver's licenses. Drug tests are part of that exam. He tested himself with a cheap drugstore test and tested positive for marijuana. However, when he tested himself the same day with the more expensive government-recommended CDL testing kit, he was negative. I can only assume that the CDL testing kit actually tested for THC, while the cheap drugstore test kit probably just tested for cannabis metabolites, not THC. I have another colleague who's a veteran and treats a lot of veterans who would lose their benefits if they test positive for THC, and he uses and recommended the brand that I'm using because he feels it's safe for his discharged veteran patients. Now, finally, people ask me what brand is best. That's tough to say. There are a lot of reputable companies out there producing quality products like Metagenics and Quicksilver Scientific and others. The key is to look at the information the company is willing to share with you. How is it extracted? What is the composition or the purity of the product? Is it water soluble? Is it full spectrum hemp? What is the absorbability rate? See, the brand that I'm testing was recommended to me by several colleagues who've done extensive research into several different companies and found that this particular company was the only one willing to provide all of the information and had its absorption study done by an independent lab. I'm not here to push a product. I'm not looking to be the CBD doctor. So if you want to know the brand I'm currently testing, you can email me at drsmith at shorehealthinstitute.com and I'll send you some info. How much does it cost? Well, the good stuff isn't cheap. It may cost you $100 to $150 for a month's supply. Just remember, if you get the cheap stuff at a gas station or a vape store, you may not be getting quality product. Sometimes you really do get what you pay for. Well, that's what I got for you for now. Hopefully I was able to give you some good information and didn't bore you too much. Feel free to share this video and don't forget to like and follow this page for more nutritional and functional medicine information like this. If you have any other questions, leave them in the comments section below. I'll try to get back to you. Again, if you want other information, don't hesitate to email me. I'll be happy to try to get you any information that I have that might be helpful for you. Okay? Great. Have a good night.